Hello and welcome back to the second installment in AHRMM's series on supply chain waste reduction. I'm here again today with Tariq Kahn, the Materials Manager of Perioperative Services for Montefiore Medical Center. Today we're discussing the business and clinical sides of healthcare. Mr. Kahn, welcome back. In our last webcast, you'd mentioned the clinical goals versus supply chain goals. Could you talk a little bit more about that and explain more about how having the right people, per se, in place is crucial?
When you look at the dynamic relationship between the business side of healthcare and the clinical side of healthcare, a lot of times people on the outside think that we have very different agendas. And it's funny because being on the business side and trying to keep standardization efforts afloat, and not that we're not open to new ideas, of course we are, but standardization as far as controlling our purchasing power, reducing our cost per case, it opens up the area for us to explore different things. And if you're not in it within healthcare, I have to say when I first got involved within the supply chain side of healthcare is when it really kind of expanded my mind. Previously I was in ambulatory care where it was solely operations and just looking at policy improvement, whereas now being on this side and seeing how the different groups come together and how it affects patient outcome, it's something that I'd never, well, I can't say never, but something that would have been challenging to recognize. Mm-hmm. And as much as people may think that there are competing agendas, they really are ultimately the same. A physician will want to control the efficiency of how they're treating the patient, which means that they don't want exactly the bringbacks unless it's necessary. They want to make sure that whatever they can do surrounds quality, how well they treated their patient. And by our support staff trying to provide the mechanisms that they need, or within supply chain, having the supplies always available, or the implants, anything that's necessary, controlling and mitigating any anomalies, it really helps to kind of get there. And of course, for us as support staff, our customers tend to be within the OR, within peri-op, surgeon, nurse, and patient. And by kind of having those personnel there, the right personnel, and by right, I mean the people that are invested, engaged. It's a quality that takes time and motivation. But at the same breath, as leaders is what we're here for. There's really nothing else that we can do if we don't motivate. That's what the best leaders do, and that's the human factor of it. That's how it comes together. Every single step that's involved, there's a person who's accountable, responsible, and engaged in what they're doing.
Thanks so much, Mr. Kahn. Join us next time for the final installment in our series on supply chain waste reduction. We'll be speaking with Mr. Kahn again on service line meetings for successful clinical integration and cost reduction. And, as always, check out the AHRMM Knowledge Center for more education content like this. See you next time.